All right, this is Dr. Beau Beard. We're going to be talking about the what, why, and how of mobility. So, this is boiling down the principles of mobility to help you to be able to efficiently and effectively do routine maintenance on yourself and hopefully keep yourself healthy and doing what you love. So, let's get going here. So first of all, when we're talking about anything to do with how the human body moves, functions, is going to act and react to injury or athletic endeavors, I always just tell people that it's like an adult diaper, it depends. So everybody's situation is a little bit different, so you have to take that into account, and that's where sometimes it does fall out of your own hands and you need somebody to help you with assessment, coaching, whatever it is. But just every once in a while, it's going to be a little bit different than the norm. And I would say maybe not every once in a while, maybe that is the norm to be different. So, what is mobility? The very broad definition would be capable of being moved. When we're talking about mobility as far as it pertains to athletic function, we think of the ability to actively achieve a range of motion, which is going to be the combination of flexibility plus strength and control. So in this slide, here's our two great examples. So on the left-hand side, you see this awesome contortionist position, but she's having to hold her leg into a position. So we would have to venture to guess that she may not have control, but when we look over to the right, she actually has even better position here, and she has full control. So that would be true mobility. So it's that flexibility with active control, which we need when we're going into athletic endeavors. We're going to load and almost max out those joint ranges of motion. One thing that gets a little misconstrued is that mobility equals injury treatment. I know sometimes when we foam roll or we stretch or we do drills or exercises, we can relieve pain. But what we have to realize is that mobility, which the term mobility itself has become just kind of, it's been thrown around the room a few times, bastardized a couple times, and nobody really knows how to define it anymore. And it's just it's a tagline now for marketing purposes, but it is not injury treatment. If you have persistent pain that is limiting your function or getting progressively worse over time, I'm going to venture to say that a foam roller, a lacrosse ball, some voodoo floss, some bands, and some fancy drills are probably not going to work you out of that. You may be lucky, but just like the second slide that depends, you have to take into account your unique body as far as capability and ability from a structural standpoint and just a kinesthetic awareness standpoint. But when we think of mobility drills as injury treatment, we're setting ourselves up for a loss. So we may spend too much time trying to treat an injury, which sets us up for a fail because now we have to take more time off from the things that we like to do. But also getting over initial pain or injury as soon as we can is going to allow us to not basically foster space for more compensations, which then can lead to their own injuries. So we don't want to be running around slamming through movements, continuing to run, continuing to do our sport with too much pain because we're altering movement, which in the end makes that initial injury worse, sets us up for other compensations that can basically lead to their own injury. So when we're talking about mobility, what are our goals or what are the objectives of mobility? So these are just pretty basic. So joint, soft tissue, and organism health. We're going to break all these down individually. Injury prevention. Now, I said we're not treating injuries. I'm going to tell you right now, we also can't really prevent injuries. So this should say injury limitation. We're trying to limit injuries best we can, right? Because the thing is, if you're going to go through, if you're going to participate in athletic endeavors, say you're going to hit the trail, like I'm stretching out after a trail run here. If you're going to run a trail, chances are you're going to, hit an awry root or rock and you're going to roll an ankle. You may take a spill. We always say you're not a trail runner until you fall. Injuries happen. We're just trying to limit them by basically, we'll talk about how we're going to limit them when we break this down. Efficiency. So soft tissue efficiency, neuromuscular efficiency. A lot of different efficiencies go into why we're going to be doing mobility. strength, and overall performance. So you could add all of these up to equal that our ultimate goal is performance when we're working on mobility, right? So health. So joint health. So I have a little just image here of normal, and I'm doing air quotes here, joint space, lots of joint space. Here is one of the myths we need to bust. The fact that degenerative joints or arthritic change is basically a permanent and basically just a downhill process. So the reason that your joints created more bone or laid down more osseous structures is that your joint was being negatively loaded. So your brain started to adapt to that. Your body started to adapt by basically saying that if I keep moving this joint and the things around this joint in this manner, I will eventually break down beyond the body's capability of adapting. So what to do is it basically tries to stop motion the best way it knows how, which is laying down more bone. Now on the flip side of that, if we start to positively load the joint and the tissues and surfaces around it, we can positively affect that and we can reduce arthritic change. Now it takes time, right? It takes the time frame of change for osseous structure is anywhere from 18 to 24 months for complete osseous change. Now if you have complete, again, air quotes, bone on bone, like we kind of see here on the right side, there are going to be limitations to where we can get back to, but it is not a complete downhill slide as some patients get this just kind of life sentence of you have arthritic change, whether that's, knee, low back, neck, whatever, and we just write off any activity that they would choose to do. Well, we should, first of all, assess appropriately and not just base that on imaging, but then determine what change can be made safely without creating more pain or, basically perturbing anything, and then see if it's a plausible option to actually throw mobility at this. And I'm using mobility as a term that everybody's comfortable with, but I would say appropriate movement, appropriate loading over time, right? So joint health, one. Tissue health, so overall tissue health. Many kinds of soft tissues throughout the body. All of our soft tissues are based on collagen. So we could really say collagen health. And besides the physiologic or nutrition needs of our body to produce and reproduce collagen appropriately, the other part of the equation is appropriately applying force, or more specifically tension. So when we apply tension appropriately to normal or injured tissues, those tissues are going to respond by basically organizing themselves in a manner that allow us to adapt appropriately. The other thing that we need to take into consideration here is that most of the time, I would say almost all the time, even though there's a little research coming out that's showing that this may be not quite the case, but your nervous system is really what's allowing you to use the full capability of your soft tissue, whether we're talking about ligaments, tendons, muscle, fascia, right? So we always, for the most part, unless we've had major trauma, have full capability to go through the full stretch shortening cycle of our soft tissues. What limits us is the nervous system due to a perceived instability, fear avoidance due to pain, previous injury, all sorts of things will lead to lack of range of motion or lack of flexibility. And it is rarely that the tissue itself, as a lot of us have been sold, is fibrotic, tight, short, all of these things that would lead us to believe that physiologically we have a problem that we need to fix. So we can kind of start to rule these things out and also re-educate people on how they go about performing mobility instead of thinking that we're smashing and grinding and getting fascia to glide on one another. Like, we're really kind of playing with the nervous system here to allow access to full flexibility and mobility. And then overall organism health. So when we keep our joints healthy, our tissues healthy, we can move through a full range of motion under control, which is a positive experience for all of these structures, also a positive experience for us mentally, right? A movement practice such as any movement practice, really. I mean, yoga, running, any kind of exercise, when we can go through full ranges of motion without pain, we're going to have a positive experience. And now we get that, the full release of endorphins. We get to repeat it as much as we want, as long as we take care of ourselves, and as long as we're taking care of the other components of health, right? So we've got, to name a few, we've got rest, nutrition. Obviously, we're talking a little bit about the mental aspect, meaningful relationships. There's a lot of components here, but from the physical standpoint, we can get the building blocks under control, which allow the other ones to kind of help fall in place. So when we're talking about injury prevention, mobility, like I said, is not treating an injury, but it can definitely help us create buffers. And what I mean about a buffer is, let's take, for example, a runner. So a runner, as they go through the swing phase and they're coming up through kind of knee drive, hip drive, on average, we're going to need about 120 degrees of hip flexion for most runners, whether you're sprinting or a distance runner. If my max range of active hip flexion is 140 degrees, that means that I'm almost maxing out my hip flexion with every stride that I'm taking, right? And if we look at the principles of the law of specificity as it pertains to exercise physiology, we know we're going to have kind of a normative buffer of around 15 to 20% when we stretch of like gains and loss, right? So if I stretch for a while, I may get a little bit better, but I'm always going to slide back to where I was unless I repeat the process day after day. But a buffer allows us to make sure that we're not maxing out our joints and our soft tissues over repeated bouts of movement and exercise to decrease injury, which should make sense, right? So if I'm always going into that, physiologic range of my joints and soft tissues and the capsule, then I'm putting undue stress on them. When I play in the middle zone, that's where I stand the least chance for injury. But it's also I guess I would equate it to a comfort thing. So if your brain, your nervous system realizes that you have a wider range of motion, you're going to have more feedback to basically pick up on. So if my ankle can dorsiflex 30 degrees versus 10 degrees, my brain has more room for error versus if I hit an awkward step on the trail or on the road and it's going to dump into inversion or eversion versus being able to go further into dorsiflexion because it just hasn't ever been there. It doesn't know how to basically like read that dorsiflexion. So it's both it's a buffer from an actual joint range of motion, tissue, I guess you could say comfort, but also from a proprioceptive standpoint. And to just piggyback, all these kind of build on one another, we talk about efficiency. And when I'm talking about efficiency, I'm really talking about kind of the passive structures of soft tissue efficiency. And we get into this more in endurance athletes. But as you can see here, this is the habitable zone, is also called the Goldilocks zone. And that where this comes from astronomy, but the habitable zone is basically the area around the sun where we can life is supported based on the elements and the distance from the sun. But the Goldilocks zone in the world of mobility and performance and in athletics tends to be that the basically the equation of adequate range of motion plus sufficient soft tissue, I guess, stretch shortening cycle to where we can load the passive structures of the body adequately to not have to be working as hard with the active structures. So the best example of this is the windlass effect through the Achilles and the plantar fascia of the foot. So as we go through contact with the foot, say when we're running, sprinting, we're going to go into dorsiflexion. We're going to start to go through a bit of pronation. As we do that, we go through big toe extension. And as we do this, we start to wind up the plantar fascia, which winds up the Achilles, and we get this tightening effect of these actual massive soft tissue structures. Now, if we have good ankle dorsiflexion, good big toe extension, we have adequate pliability and sliding through the fascia and the muscle and the tendon and the ligaments, we will get a massive kind of rubber band effect where we wind that tissue up. And as we go through toe off phase, where we're going to go through big toe flexion, we're going to go through ankle plantar flexion, all of those soft tissue structures let go all this elastic energy, and we have to do less pushing and pulling with the calf, the hamstring, and the glute. Now, for our endurance athletes or distance runners, this is a huge deal but it's still a big deal for our explosive sprinting athletes because it's, again, efficiency is king in almost any sport, and we don't want to have to pull from the active structures, or we want to pull from the active structures as little as we can. So if you guys wanted to look up anything like that, again, that's called the windlass mechanism. And a windlass is the crank that pulls up a bucket out of the well. So that windlass, just imagine that you're winding those tissues up underneath your foot. It occurs in many areas in the body, around the shoulder, around the neck, all sorts of areas. So next, strength. I have a slingshot here. So many people have probably heard the analogy when it comes to strength, that if I pull the whole slingshot back at once, right, not nearly as powerful, maybe not work as well as if I hold the handle still and I pull the sling back, and now I've created some elastic recoil. Same thing for the old adage of you can't fire a canoe or can't fire a cannon from a canoe. So with strength, if I'm tapping out the max range of motions due to lack of mobility or active flexibility, is how we could also, basically deem mobility, that means I'm going to be weaker in these ranges of motion. So everybody knows that if I had my elbow fully extended and I asked you to push me up into elbow flexion, I'm going to be weakest at my furthest out point with my elbow fully extended. I'm also going to be weakest with my full elbow fully flexed. So it's those mid ranges where I'm the strongest. So it should make sense that if you can increase your end ranges, right? If we're talking about the elbow extension and flexion, then I have a wider variance of range of motion to pull from to be strong from. So it's just the same lines, those injury prevention buffers. If your shoulder can only go up to 160 degrees and I'm going to load it overhead with weight and fall into maybe a range of motion that I've never been in or that I can't actively control, now I'm tapped out strength-wise and now I'm set up for an injury. And when we really break down jumping into the performance realm, which kind of adds in all of these previous assets that we're working on, we really want to talk about accuracy versus precision when it comes to movement. So accuracy is hitting the same target over time. Precision is hitting the same target, but we're hitting the same movement, but it may be different over time. So let's explain that a little bit. So in the last one, you can see not accurate, not precise. So we're all over the place. So precise but not accurate means, I knew I was supposed to hit that snatch. I maybe didn't hit it just like I wanted, but I did it the exact same or as close to the exact same as I could every time, even though it wasn't really what I wanted to do or wasn't what I was being coached on. Versus accurate and precise is that snatch looked awesome. I repeated it every time. You could correlate this to a golf swing, right? So say you're being coached on hitting a draw. I take 10 shots. Every one of them is a little baby fade. It wasn't what I was being coached on, so it's not really accurate, but I was precise, right? I repeated that same thing over time. Now, the best athletes in the world tend to be very accurate and very precise when it comes to just general movement. So every movement that we perform, whether it's day-to-day tasks or athletic endeavors, every movement we perform is varied. We are never performing the exact same movement. So we're always pulling from a different neuron pool. We're pulling from different muscle fibers. We're always hitting a little bit different angles through the joints because you got to realize we have a lot of things that are adding up to a single movement. But the best athletes get as close to the previous movement as they can be, and then it's repeatable over time. And that is because they have great kinesthetic awareness, or we could just break that down into layman's terms and say great body awareness. They have great feedback, right, from their inner ear vestibular system, their visual system, and then proprioceptive, which is going to take in tactile sensations through the basically 4 big sensors in the skin, joint mechanoreceptors, right, and then all of the structures, soft tissue structures, have mechanoreceptors or stretch, Golgi tendon apparatus, and all of these things that go into adding into proprioception are going to be really dialed in our best athletes. Now, even the best athlete, though, is going to have an injury every once in a while, and the whole goal of post-injury care, which you could call mobility, right? Working on those soft tissue structures, working on range of motion, working on the motor programming part, is to basically get you back to square one of having that great feedback system through whatever joint or soft tissue structure that you injured. Now, we've talked about why we want to be working on mobility, right? We've got basically overall health, we've got injury prevention, we've got strength, we've got performance. Now, how do we work on this stuff? And I know everybody out there that's listening to this, or maybe you haven't, has done some foam rolling, seen a foam roller. We've done some stretching probably. We've done some drills or exercises. We were warming up. But if we can really make things easy and break it down, we're going to A, save you some time, and B, we're going to be more effective. So we're not going to just chase our tails and think about what to work on. We're going to really have a game plan here. So I'll give credit where credit is due, but this is from Perry Nicholson, and this is what we just call a rail. So the R in your rail is the reset. So that's change, distract, normalize. And in the first picture here, if you can see this, we're seeing a bro here, a CrossFit bro, because he's got a shirt off with tattoos here, foam rolling. So a reset is just an input change to the nervous system or the tissues itself, and probably a little bit of both. So that's anything from foam rolling, lacrosse ball, voodoo floss, chiropractic adjustment, mobilizations, soft tissue, hands-on therapy, massage, right? So we're inputting something into the nervous system via the keyboard of the nervous system, which is the body. Now that input is going to allow for temporary change, and when we get that, we want to activate that area, that joint, that soft tissue, and the best way to do that is a low-level single joint movement. All right, and we'll go through an example of this when we go break this completely out. The next part would be to integrate that single joint or maybe a assisted or a passive movement into a bigger pattern and a global motion, right? And the last part would be to load it. And that means performing reps or doing a certain movement or adding weight to it to basically challenge or tax your nervous system to almost hit the save button on a document of movement, right? So when we challenge a movement with good mechanics, full range of motion, that's a positive experience. We want to hit the save button on that. So let's use an example real quick. So let's say we're working on hamstring mobility, right? A really common one that people either think is tight to begin with, and sometimes it may be tight, but it really sometimes doesn't matter if it's tight or not. We can treat it the same way. So in a reset, a lot of you out there could probably name a lot of ways to work on your hamstring, right? We could foam roll it. We could use a lacrosse ball. We could wrap voodoo floss around it. We could have somebody work on it for us. So it's some sort of reset, right? Now, we may want to think outside the box a little bit. So we may want to work kind of up and downstream, which this is stuff that you can see old K-Star here in his little Baby Bjorn band here in the middle. He talks about going up and downstream from your main issue, right? So if we think we've got tight hamstrings, maybe we foam roll and work on the glutes, the calves, and maybe even the bottom of the foot, right? That's part of the lower extremity posterior chain. So we're just getting a little smarter. We're thinking, all right, let's work on all of this rather than just the main area, which is going to help create more input to the nervous system, and it's just going to get us there a little faster. So now we've done our reset. Now we want to activate. So this low level, often single joint. So if I'm working on my hamstring, a good way to do this would be just lying on your back doing straight leg raises. There's all fancy ways to work on this. We could load one arm with a kettlebell. We could give you some bands to kind of help reflexively turn your core on. Just doing straight leg raises is going to help activate what we need to get that hamstring to let go via using the hip flexors and the core to kind of pull us into hip flexion. Now, if we wanted to integrate this motion, we could do all sorts of things. We could do single leg deadlifts. We could do just regular deadlifts. We could do all sorts of stuff. And this is really where I start to try to get people to realize is let's say that I have troubles touching my toes, you could just basically go from a supine active straight leg raise into a toe touch, right? Or even certain things like a Jefferson curl or unloaded or light loaded deadlifts. And now we're challenging the posterior chain, or we're kind of working in that global motion pattern after the single joint movement. And then the last thing we do is load it. So we'd take those movements. We could just do maybe a tempo deadlift, right? So we could do a 5-second eccentric load and a deadlift, light weight, maybe no weight at all. And now we're kind of grooving that neural pattern, and we're getting our brain to hit the save button on that movement document. Now, there are really no roadmaps here, right? So this does take some creativity, and we have a huge library of videos on our YouTube channel, which is just YouTube and then Cairo Farm. So you can go out there and find those. All, K-Star, Mobility WOD, everybody's got some great videos, and it's not about the drill. It's about how you take all of these things, put them into a workable kind of roadmap for effective and efficient mobility. Now, what is missing that we're not talking about when we are discussing this rail system? And sometimes we do get into it, but this is where it sometimes takes a little bit of coaching or outside help, because it doesn't have to be super complex, but it gets a little tougher, are things like where stability and breathing come into the equation of actually how they affect mobility. And even though we're going through this rail system, I would say 9 times out of 10, there's usually a stability issue at the root of most mobility problems. So what does that mean? So let's say I can't touch my toes. The hamstrings are notorious for being kind of a parking brake of just general movement going through flexion or a toe touch. So the parking brake analogy basically means that the hamstrings may not be tight. It may be your nervous system kind of limiting motion due to a perceived threat, prior injury, actual lack of mobility in a certain area that's going to overload another area. And tapping into things like proper breathing, diaphragmatic breathing, stability patterns around, multiple joints. I mean, lack of stability in an ankle can definitely affect things upstream. Lack of stability in a shoulder can affect things all the way down to the ankle. So it's all connected, but at the same time, we don't have to make it complex. If we could just work on some simple breathing patterns, we maybe dictate, are we more on the spectrum of a very tight, restricted person, or are we a very mobile, hypermobile person? And then we can dictate mobility based on those as well. So it's also kind of just doing a self-evaluation. We can talk about that in future presentations or webinars as well. But what makes all the magic here is knowing what to work on, right? So what I try to get my athletes to realize is that when you're warming up, right, whether we're going out to run, play tennis, play golf, going to the CrossFit gym, our warm-up should be a window into two things. Should be a window into the activity we're about ready to perform. Should also be a window into how are we moving that day. Because one thing I can promise you is you do not move the same every day based on what you did the day before, even the week before, and the month before. And sometimes on what you ate, what you drank, all those things affect how you move and the quality of the tissues and movement, right? So your warm-up, and this is where I can't say this is the warm-up you do for the sport, because I don't know what your movement issues are. So we go back to it depends, right? But let's say you have tight ankles. Well, something in your warm-up should be A, warming your ankles up, getting them moving. B, if you notice a difference in one ankle to the other, or you feel a little bit of a little bit of pain, a little bit of tightness, that's where you have to jump back over to the mobility kind of side of things and go through that rail system. And this doesn't have to take a ton of time. But now we've used that warm up as a diagnostic measure to hopefully offset any injury scenarios, but also we're trying to constantly increase performance, workout after workout, or just activity after activity, because not everything has to be outcome, end of the road competitive output, right? So not all of us are training for something. Some of us are just training to stay in shape, stay healthy. So it doesn't have to be, man, I'm training for the CrossFit Games. Man, I'm training for a marathon. It could be, I just want to keep moving well enough so I can exercise whenever I want, or go do whatever I want. I want to go hike on the weekend. I want to go swim on the weekend in the lake. All right, well, we have to still perform maintenance on our bodies because we live in a society where we do not set ourselves up for a movement win, right? We spend a lot of time in static positions. We sometimes don't have the greatest nutrition. We have a lot of stress and anxiety that also tax the nervous system and the tissues, and our sleep may not be great. So we need these little diagnostic check-ins, and one that I can suggest on our YouTube channel for sure is like the global CAR, or controlled articular rotations. So we basically use the functional range conditioning principles to go through pretty much every joint of the body through these basically slow controlled rotations of the joints to perform routine maintenance on the joints, but also determine, am I moving adequately and do I have pain? So that's a kind of just really broad-based warm-up that we use. You must have a goal. So usually if we're warming up, our goal is to work out or move or go, compete. If you don't have a goal for your mobility, then you're kind of lost, right? If I say, well, I'm working on my hamstrings because they feel tight today, but let's say I never see any improvement in my toe touch or my straight leg raise, or I can already touch my toes, but I'm always feeling tight in my hamstrings. Well, now we've got a problem, right? Because we're not seeing change, or we're working on something that we probably don't need to work on. So establishing your goal can be a lot of the times done through your own assessment, right? Through these movements, these warm-ups, and determine, man, I need to see change and address it and make sure that that's happening. And if it doesn't, that's where you sometimes need to outsource your care, your movement to a practitioner, right? Somebody that can look at how you move, and definitely if you're having an injury, look at you and help you, coach you through these things, educate you on what your goal is, how to appropriately, effectively, and efficiently accomplish that goal. And last, you must be disciplined. You can have the best assessment, the most well-defined goal, and if you lack discipline and follow through, nothing's going to happen. So you actually have to do it. And that goes for anything, and we all know that. But even though we all know that, that's the probably biggest hindrance to creating long-lasting change when we're talking about controlled flexibility or mobility. Well, I really appreciate you guys joining me for this. If you check out our website here, chirofarm.com, like I said, we have a library of a lot of exercises that can help guide you through the process of working on your mobility. If you have any questions, you can get a hold of me at drbeaubeard@gmail.com or at social media at drbeaubeard. Thanks, guys.